Imagine stepping into a world where there was no toothpaste, no toothbrushes, and no modern anesthetics to dull the pain of dental procedures. This was the reality of ancient Romans who, despite their advanced engineering and architectural feats, the answer isn't as simple as you might think, and the truth lies somewhere in between. The basics of Roman dentistry, they had advanced methods for treating wounds, surgeries, and even illnesses. The tools used for procedures like tooth extractions, fillings, and even tooth whitening were crude and harsh by modern standards. Yet, these methods were born out of necessity, and many ancient dental practices were linked directly to medical procedures aimed at relieving pain. Imagine a thick, curved metal hook being inserted into your mouth, grasping the tooth, and yanking it out without anesthesia, of course. This method often resulted in broken teeth, bleeding gums, and extreme discomfort. Dental drills, though primitive by today's standards, were employed to remove tooth decay. These were hand-powered drills, often operated by turning a wooden handle with a metal bit to scrape out the decayed parts of the tooth. While they were certainly effective in removing decay, but the Romans did use abrasive powders and pastes to clean their teeth. These often included crushed bones, oyster shells, and charcoal. With their lack of anesthesia, crude design, and harsh techniques, these procedures were undoubtedly painful. However, when we look at them through the lens of ancient medical knowledge, they were groundbreaking in their own way. Oral hygiene was not a priority for the general population, but the rich and powerful saw dental care as a means of preserving their image and social status. As we discussed earlier, many Roman dental procedures like tooth extraction, drilling, and even fillings were brutal, painful, and done without anesthesia. Roman medical texts, particularly those of Galen and Celsus, he believed that the state of the teeth reflected a person's overall health and well-being. Celsus, another prominent figure, these professionals were often slaves, with knowledge of the medical practices learned from their Roman masters, as having clean, straight, and well-maintained teeth was a sign of wealth and power. Romans used gold to craft crowns and fillings for their teeth. Their influence can still be seen today. The Romans were among the first to understand that repairing teeth was a viable option for preserving oral health. Today, dental fillings and crowns are made from far more advanced materials like composite resins, porcelain, and gold, but the core idea remains the same. The tooth extraction tools used by ancient Romans laid the groundwork for the tools we use in modern dentistry. And the often brutal tools all make Roman dentistry seem more like torture than treatment. And yet, for all the horror and discomfort they caused, Roman dental tools were a stepping stone in the evolution of oral health care, paving the way for the advancements we enjoy today. The basic principles of tooth extraction, the need for precision, the exploration of pain management, the development of dental tools, and the recognition of oral health as an important aspect of overall well-being all stemmed from early Roman efforts, or were they simply instruments of pain? Perhaps they were both tools that, while harsh, ultimately paved the way for a more refined approach to dentistry. And while Roman dentists had no access to the modern innovations we now take for granted, their experiments with dental care were invaluable, shaping the practice for centuries to come. The importance of hygiene and the understanding of dental anatomy are still central to dental practices. And while these practices were rudimentary, they reflected a desire for beauty and perfection, not unlike modern cosmetic dentistry. But the idea of using a tool to remove decayed tooth matter is directly connected to modern dental drills. The rotary drill invented in the 19th century would eventually lead to the electric-powered drills we use today, revolutionizing dentistry forever. Roman dentistry's shadow over time. In some cases, there was a clear division of labor between general physicians and those who focused on dental procedures. Roman dentistry, a tool for social status. also contributed to early medical practices by documenting dental extraction methods and prescribing basic care for teeth. While their practices may seem rudimentary today, the elite of society sought out tooth restorations and other dental treatments to preserve their image and status. Having gold crowns or decorative teeth was seen as a luxury, and these high society individuals often paid a premium for dental services that enhanced their appearance. These texts were some of the first steps toward turning dentistry into a recognized field of study. Began to recognize the significance of dental care and the necessity of understanding oral diseases. Although these texts don't go into the minutiae of dental procedures, they mark the beginning of more formalized medical thought on the subject. But these techniques were often the only options for those suffering from tooth-related issues. The Romans were attempting to address a common problem with the best tools and methods available to them at the time. Tooth extractions, drilling, and even the use of herbal remedies were essential for managing toothaches and infections. These methods were often seen as necessary evils, and many poor Romans had to endure painful dental procedures because they lacked access to the elite's more refined treatments. The influence of Roman dental tools on modern dentistry. Imagine having a cavity filled with a substance as simple as beeswax, a procedure that would undoubtedly lead to further discomfort. Or imagine having a decayed tooth extracted with a hook-like instrument, the pain and trauma of which would likely have caused swelling and bleeding. Despite the discomfort, these methods were relatively advanced compared to other parts of the ancient world, where dental care might have been nearly non-existent, all mixed with various flavoring agents like mint and myrrh to mask the foul taste. While these mixtures helped in cleaning the teeth to some extent, but they got the job done, for better or worse. There was no careful sterilization of instruments, no pain management, and no concept of aftercare to help reduce the risk of infection. Despite all this, it was still better than the alternative, leaving a tooth in place that could fester with infection and cause worse health issues. Roman medical texts and the rise of specialized practitioners without the Roman experimentation with tooth extractions, fillings, and drills, we might not have the sophisticated dental techniques we use today. The legacy of Roman dentistry, medicine, pain, and modern influence, they did little to address the root causes of dental decay. While it's easy to dismiss their techniques as crude and barbaric by modern standards, these practices were vital steps in the evolution of dental care. Were they medicine, or were they simply tools of torture? The truth lies in a mix of both, and the influence of these ancient methods can still be seen in modern dentistry. The painful reality of dental care in ancient Rome, such as diet and bacteria. The drilling process was brutal and would have caused intense pain. Roman tooth fillings and crowns, practical or barbaric. Ancient Roman texts suggest that urine was used as a mouthwash due to its ammonia content, which they believed helped disinfect the mouth. Though it may sound bizarre by modern standards, it was a common practice at the time. The fine line between medicine and torture making. The procedure seemed more like an act of torture than treatment. They did, in fact, develop methods for filling cavities. Using materials like beeswax, bitumen, and even gold, they would fill cavities to prevent further decay. While these fillings would not last as long as modern ones, they were an attempt to address tooth damage and decay. Roman dental tools. The instruments of pain, but the pain they would inflict on an unprepared patient would have been unimaginable. And there was no numbing of the area or pain relief. Only the cold, hard steel against the gum's dot, thanks to the extensive work of doctors like Galen and Celsus. These were usually used to replace teeth that had been lost, offering a form of restoration and aesthetic appeal. However, while these crowns may have been practical for those who could afford them, they also hint at a vanity-driven aspect of Roman dentistry where looks often mattered just as much as medical necessity. The role of dental hygiene in ancient Rome. Dental care, however, was more of a luxury than a common practice. reserved for those who could afford it. For the most part, Romans did not have a strong tradition of preventative oral health, meaning most people didn't seek dental help until problems became unbearable, had a curious and, at times, terrifying approach to dental care. Their tools, as crude as they were, offered a glimpse into how the ancient world treated oral hygiene and dental issues. But the question remains, were these dental tools an essential part of medical practice, or were they simply instruments of pain and torture? Toothaches were common in ancient times, often caused by tooth decay, abscesses, or infections that would leave the victim in agonizing pain. With no antibiotics, the pain could become excruciating. And for a raw man in agony, the only option was a visit to the local healer or barber surgeon, who would use the most terrifying dental instruments of the time. The Romans were not without some understanding of health and medical care. But when they did seek care, Roman dental tools were as terrifying as they were necessary. One of the most notorious aspects of Roman dental care was the tooth extraction process. The dentale, a large hook-like instrument, was used to remove decayed teeth. Additionally, Roman dentists used saw-like tools to cut through infected gums or teeth. These saws were highly effective at cutting bone, but these weren't the only tools in the Roman dentist's kit. Despite the crude nature of Roman dentistry, the Romans were ahead of their time in some areas. Interestingly, some wealthy Romans had gold crowns placed on their teeth, a precursor to modern dental crowns. Roman dental hygiene, or the lack thereof, was a stark contrast to modern-day practices. Toothpaste as we know it didn't exist. The Romans also had an unusual remedy for bad breath. They used urine. At first glance, the dental tools of ancient Rome may seem like nothing more than instruments of torture. While it's easy to view Roman dental care as barbaric, it's important to recognize that these practices paved the way for modern dentistry. As we continue to explore the ancient Roman approach to dental care, it's essential to examine the cultural and historical legacy that Roman dental practices left behind. For the average Roman, dental care was often a necessity born out of desperation rather than a regular practice. Roman dentistry was, by all accounts, a trial of endurance. The practice of teeth extraction, often done in the Roman Empire, was no doubt excruciating. The tools used for this procedure were primitive. While many Romans might have relied on barber surgeons or general healers for dental issues, the practice of dentistry became more specialized over time. Galen, one of Rome's most famous physicians, wrote extensively about the body, anatomy, and treatment methods. As Rome expanded and its empire flourished, more specialized dental practitioners emerged. For the wealthy Romans, dental care wasn't just about health, it was a symbol of prestige. The elite class was far more concerned with the aesthetics of their teeth. For the common people, however, dental care was not about beauty, it was about survival. Despite the pain and barbarism associated with Roman dental tools, even the concept of fillings and crowns dates back to Roman times. Though their materials were rudimentary, additionally, the Roman dental drill might seem primitive by today's standards. While ancient Roman dentistry may seem like a far cry from modern techniques, it laid the foundation for many practices we still rely on today. However, we can't ignore the painful reality of those early procedures. The lack of pain relief, the crude methods, the true question remains: were Roman dental tools an early form of medicine,